Hello, good morning, and welcome to my new channel where you and I discuss health. It's a pleasure to meet you again today so that you and I can go on to dismantle what it is to do with diabetes. My name is Dr. Manu, a medical doctor specialized in ophthalmology with a passion to see you well, spiritually, mentally, psychologically, and of course, physically. Today, you and I will discuss obesity and diabetes. Is there any relationship having obesity and end up developing diabetes? We shall find out after the break. Thank you and welcome back. You and I will discuss obesity and diabetes. Always remember that all we discuss in this channel are only intended to be informative only. This is not a medical consultation, nor a personalized medical advice. For full medical advice, please do consult your general practitioner. Having made that clear, is there any relationship between diabetes and obesity? Given the escalating prevalence of type 2 diabetes in many parts of the world, the relationship between these two conditions has generated a great interest and research among many fields of medicine. This stance is also supported by Ekel et al., who argue that most patients with type 2 diabetes are obese, and the global epidemic of obesity largely explains the dramatic increase in the incidence and prevalence of type 2 diabetes over the past 20 years. Many studies have generated interesting findings that show that obese individuals are up to 80 times more likely to develop type 2 diabetes than those at normal weight. As a result, obese individuals must be informed on the proper management of diabetes should they develop it. Now, when we are full, the fat cell produce hormone called leptin to regulate metabolism and appetite of the body. Leptin is a hormone predominantly made by adipose cells and enterocytes in the small intestine that help to regulate energy balance by inhibiting hunger, which in turn diminish fat storage in adipocytes. Leptin acts on cell receptors in aqueous nucleus of the hypothalamus. However, when there is excessive insulin resistance, there is also high quantity of leptin, and the latter is unable to send message to the brain to stop eating. That is the reason why diabetes and obesity go hand in hand. Both should be viewed as hormonal and biochemical problems. Studies have shown that even a modest weight loss has shown to improve glycemic control and reduce the necessity of glucose lowering medication. Therefore, we can understand that obesity is a major cause of diabetes, and if obese individual wants to prevent diabetes or start in a journey to cure himself, to cure diabetes, he must lose weight, because weight loss is very, very important in the process of treating diabetes. I trust that today you and I have learned something about obesity and diabetes, because these two conditions go hand in hand. That is why you and I must be careful to what we eat. We have to look out our weight daily and make sure that we don't go into a lifestyle that will make us gain weight or a diet that will make us gain weight, because obesity will eventually lead to type 2 diabetes if it is not managed properly. I trust that you have been informed. As usual, my passion is to see you well and alive and strong in order to realize your goal on this earth. And you cannot realize it if you don't pay attention to what is in your plate. This is Dr. Manu reminding you that your health will improve when you start to pay attention on what you place on your plate. Peace. I love you. See you in the next video.